Hi, everyone. My name is Laura Patlin. I'm here with my group mates, Lisa Faulkner-Inoue, Abby Fitch, and Stuart Jenkins. And today we're going to be talking about the effects of raising federal minimum wage on population health. So a bit of background and then the research question. The current federal minimum wage is $7.25, which became effective July 24th, 2009. In 2016, an editorial stated that the percentage of low and minimum wage workers has been increasing over the past 15 years, and studies have found that income inequality has been worsening in the United States. The current demographic of a minimum wage worker probably looks a little different than what people would assume. The average age is 36 years old, with a higher percentage of those being 55 years or older, more so than adolescents, and approximately 2/3 of them are aged 25 years or older. In 2017, Horton et al. Posed a poignant public policy question. How do minimum wage increases impact workers holistically across multiple dimensions that include but aren't limited to the usual question that we tend to ask, which is employment? And based off of that, our research question is, what are the effects of raising the federal minimum wage on population health for US adults? Bit of context, we did consider various health factors and studies that addressed a combination of those health factors, including suicidality, health behaviors, weight, among others, which will be addressed further in this presentation.
Our inclusion criteria was research published from 2010 to 2022, minimum wage earners age 18 and older, studies and evidence conducted in the United States, ethnically diverse populations, and rural and urban populations. Conversely, our exclusion criteria was research published prior to 2010, minimum wage earners less than 18 years, and studies done in countries other than the United States. So out of the 13 selected eligible evaluations that specifically focused on increased minimum wage and its effect on health outcomes of adults in the United States, 12 of these studies were published in peer-reviewed journals. And the quality of study designs are as follows. 77% were of high medium quality, 15% were of medium quality, and 8% were of low quality. 17 methods outcomes were included. Outcome measures were included, including self-reported health, dietary intake, healthcare access, mortality, suicide, risk behavior, heart disease, household income, and unmet medical needs.
So some of the conclusions the conclusion that can be drawn was that minimum wage increase did not result in positive health incomes in every circumstance. It did in certain situations with certain individuals, but some of the factors that included them not being correlated were a loss of job due to financial strain on the employer, a loss of scheduled work hours, impact on temporary assistance for needy families, supplemental and nutritional program benefits, and there was no impact on risky behaviors such as excessive drinking and smoking. Minimum wage did result in lower suicidal rates for adults with higher education or less, fewer mental health days for women, and lower unmet medical needs and infant mortality.
So the studies pointed to several recommendations that we think would be helpful for further research and policy considerations. So first being wage increases in conjunction with tax breaks incentives for employers to prevent layoffs, to provide more stability to low-income earners who earn the minimum wage, or incentives to support health benefits for employees. Often these jobs come without benefits, so including that would be a positive health outcome. Second, wage increases in conjunction with other policies and strategies to protect workers who may be more vulnerable to job loss is critical. And then in the research category, further studies to include the effects of other interventions, such as the Earned Income Tax Credit, access to health insurance, particularly looking at the Affordable Care Act, and access to recreational opportunities. Also more consistency and study around other populations. Most studies we looked at studied working age adults. And so looking at folks like teenagers or older adults over the age of 64 would be helpful to understand the full impact of the minimum wage on health outcomes for these populations. That it concludes our presentation. Here are the references that include some of the studies and background. Thank you all for your time. Appreciate it.